Hey everybody, it's Shanika with Labor and Love here for our live question answer session. It's been a while since I've seen everybody. Lots of things have been going on. Summer has been really busy, but working on some great exciting things from Labor and Love. Hey, welcome. So hopefully not going to hold everyone too long this evening, but I do want to start off by giving a little disclaimer that Labor and Love live question answer is in no way, shape, form, or fashion a substitute for any recommendations from your doctor, your midwife, your OB, pediatrician, primary care physician, anything like that. So this is pretty much just a question answer session. You guys ask questions, I answer them with my knowledge from my experience, from my professional background, and from experiences that I've seen other people go through, basically. But do not think that this can override whatever your doctor, midwife, or anybody else recommends. Hey everybody! I'm so excited. I miss doing this, guys. So we have a few good questions tonight, and of course, if anybody wants to type anything in while we're going, go ahead, feel free. But I think I'm gonna just dive on in. I was kind of waiting for someone to log in who asked about a serious topic, but I may just save that question for the end. Let me see. Yeah, I'm gonna put those questions towards the end. All right. So the first question I have says, I'm having lots of back pain, shooting pains, and cramping. I bought a belly band. Help. All right, so back pain, unfortunately, as the babies grow, they put pressure on your back. They sit lower in the pelvis. It gets harder to walk. We waddle. When I was pregnant, I used to wonder why pregnant women waddled. It's not because of the belly. It's because of the back pain. Well, at least that's what it was for me. Back pain can be a killer in pregnancy. So definitely buy a support band. Use a support band if you're going to be on your feet a lot. Also rest when you can, as much as you can. Put your feet up. If you're having lots of really bad back pain, I recommend prenatal massage. You can do I test this out on people who come to the prenatal classes. But I'm sorry, I'm ignoring phone calls while I'm doing this. I'm sorry. You can do a massage called the double hip squeeze, where someone would have to do this for you, of course, but you can lean on all fours or on an exercise ball, or even just kind of kneel with your arms over a flat surface. Have someone put the palms of their hand low on your hips and squeeze to relieve that pressure. Another thing you can do is use a tennis ball. So use a tennis ball, roll it on the lower part of your back, and you can even take that tennis ball and lie on your back and have it kind of wedged underneath your lower back to kind of relieve that pressure and aid some of that. But unfortunately, that's just one of those things that we have to go through in pregnancy. Let's see. Okay, next question is, how do I know when it's time for baby? You'll know. Hey girl. Hey y'all. So I say you'll know. You'll definitely know when it's the time. I think you can't mistake that for anything else. But there are false alarms. I had a false alarm, y'all. I didn't even tell my family this because I was like embarrassed. Like, how could this happen to me when I work in this? But I went to the hospital and everything. I went to my job telling people my water bag broke. I just knew that my water was broken, and called my husband because he was not home. And I was like, hey, we need to get to the hospital. The water bag's broken. So, of course, like men do, he came panicking. We got there, and I'm like, okay, not contracting. I know sometimes that happens where your water bag breaks, you're not contracting yet. And they checked me in. Guess what? I went home just like I send a lot of other people home. So false alarms happen. But when you are contracting, painful contractions, like the ones that stop you in your tracks, that you have to breathe through, you need support through these contractions. If they're consistently happening in a pattern, you know you've been drinking lots of water, you're well hydrated, you try doing some movement, nothing helps to relieve these contractions, then I would say if you're in a good pattern for at least an hour, maybe even more. But you can also have Braxton Hicks contractions that can be killers for a long period of time. So I would say contracting for about an hour every 5 minutes. Also, definitely if you have any bleeding, you need to go to the hospital. You can have some spotting towards the end of pregnancy. Hey, oh, it happened to you, false labor, right? You can have spotting towards the end of pregnancy as your cervix starts to get ready. But if you have bleeding, bright red, blood, a flow of blood, or clots, go to the hospital right away. If your water bag does break, which, I mean, things happen, you have more discharge at the end of pregnancy, the baby's sitting on your bladder, even more towards the end of pregnancy. So sometimes things can happen and we mistake something else for our water bag breaking. But definitely if you have a flow of watery discharge that just won't stop. I never got to experience any of that. Baby wouldn't come. Oh, you still got to experience a lot, I'm sure. False labor is, it happens. But you'll know when you're contracting consistently, that can be a sign, head to the hospital. Any type of bleeding, head to the hospital right away. And if you think your water bag broke, even if it's a false alarm, it's always better to get things checked out rather than to wait. Hi. All right, this next question is hilarious. Somebody wrote, I really don't like water. What can I do to stay hydrated? The answer, I'm going to flip this around. Can y'all see that? Drink water. Just drink water. I hated water. I still hate water. I didn't really drink it until I got pregnant. But when you're pregnant, you need to stay hydrated. If you're not drinking water, you're going to have contractions. Your uterus is going to get dehydrated and it's going to start to contract. So drink water. You need a lot. I mean, keep a cute little cup. I have my Yeti here. Keep something full of water. Now, if you're not a gestational diabetic, which hopefully you've been tested by this point, if you're not, then you can do teas, you can do juices, you can do Gatorade, things like that to stay hydrated. But ultimately, water is the best thing. So if you want to try to mix water in with that, but drink something, stay hydrated, especially now. It's hot. It's summertime. All right. All right. The next question is, do you have any advice for a mom diagnosed with a single umbilical artery? This is one of those serious topics that I was hoping the mom who sent this question in would be tuned in. But basically, when we examine the umbilical cord at delivery and also throughout pregnancy via ultrasound, we look to see how many vessels are in the cord. Usually we expect 3 vessels. Most cases, an umbilical cord has 3 vessels, 2 arteries, 1 vein. This mom was recently diagnosed with a single artery, meaning her baby's umbilical cord has 1 artery instead of 2. So I did look up some things. It was very funny that you sent this question in because I recently saw a case like this at work. Healthy pregnancy, healthy baby, which can happen. But some things that I pulled up mentioned that you may or may not, depending on how your prenatal visits are going, you may be monitored more for growth restriction, just because the baby does not have those 2 arteries that they're used to having for the blood flow from the placenta to baby from placenta. And sometimes when blood flow is restricted for any reason, it can be a single artery, it can be gestational hypertension, diabetes, anything that can kind of change the normal amount or the expected amount of blood flow can cause baby to have a growth restriction, meaning baby will be smaller than usual. So they'll probably monitor you a little bit more. Now, since you sent this in and you got that diagnosis, I'm assuming you're probably around your 20-week anatomy scan, which is when pregnant women go in. They literally take the ultrasound, they measure all baby's organs, and make sure everything's growing as expected. You may be seeing a specialist more often, maybe a little bit more monitoring. But honestly, if baby it stays on track with growth, everything else is going to go as it would with anybody else. So I would just definitely tell you follow all of your doctor's instructions as far as monitoring, and I'm going to give you the main reasons I tell anybody else, any other mother, to go to the hospital and get checked out. Number one, once you start feeling baby move, you're not supposed to stop feeling baby move. So once you feel those little flutters, they get stronger and stronger, and you start to know, oh, I know my baby's sleepy right now. I know when they take their naps. I know when baby's really active, which is probably when you're sleeping. So if you notice anything decreasing in what you're used to feeling as far as baby's movement, going into the hospital. Bleeding, I just mentioned that if you have any type of bleeding that's more than spotting towards the end of pregnancy, go into the hospital. If you feel like you're having contractions, pain, consistently for an hour, the ones that stop you in your tracks, you have to breathe through and kind of pace yourself, definitely. And then if you think your water bag broke, any type of watery discharge. But what I was also reading in the research, I actually pulled it up on the system at work, just because I told you I recently had a case like that at work. And what usually happens in like the best cases with the single umbilical artery is that artery is a little bit larger than it would be to compensate for that blood flow. So I've seen good cases. I've seen successful, healthy pregnancies and healthy babies with it. So I'm just going to wish you the best and keep you and baby in my prayers and keep us posted. Hey, everybody. All right. Next question. This is the last one that I had that was sent in beforehand. Any tips for a water birth? Yes. So, to the mom who sent this in, I'm assuming you are planning to have a water birth, which is wonderful. I love water births. I did not have one myself, but I have seen and worked some beautiful ones. So, for those of you who don't know, when you do a water birth or use hydrotherapy for labor, you can use water for your comfort. So you can either labor in the tub, let the warm water soothe you, kind of relieve some of that intensity of contractions, or you can actually deliver your baby in the tub, depending on your doctor, depending on the situation with your pregnancy. Low risk situation, you can deliver your baby in the tub. So, recommendations I have, patience. You have to be a patient person. I recommend letting labor start on its own if you want to have a natural, unmedicated water birth. Because when you're in the tub, you cannot get an epidural, you cannot have pain medication on board. So if you want to do a water birth, be patient, let your body do its thing. Natural delivery, whether you're in the water or not, I recommend resting and eating as much as you want. Not eating, resting as much as you want early in pregnancy, in labor, because once things get really, really active and those contractions start to hit you, you're not going to be able to go to sleep. So eating light snacks, crackers, juices, things like that early in labor. Once things really get kicking, you're not going to care about eating. So rest as much as you can early on, because honestly, if labor is a long thing, and you get exhausted, mentally you're just going to be done with the whole water birth, the whole unmedicated thing, because you're going to need that power. So rest really helps you sustain the mental capability to do it. So rest as much as you can early on. I also recommend having a birth plan. So write something out, talk to your doctor, talk to your support team, write out what you want, what are your desires or your preferences for labor, what are you okay with, what are your plans for comfort, what are you open to. Also, having a solid support system is very important. So when you come up with your birth plan, you need to discuss that with your significant other, your mom, your cousin, your sister, your doula, your birth support person, whoever's going to be there with you throughout labor, so that they know what your plans are and they're able to hold you to that, unless you have a safe word, a safe phrase that lets them know, hey, when I had enough and I really, really need some help, I'm going to say this word, and that's when you let me give into my plan. Otherwise, your support team really needs to be that rock for you to help you follow through with your plan of a water birth. The last thing is prepare. Take some prenatal classes. You really need to learn about what your body's going to go through, what to expect as far as pain, what to expect, what you can do as far as movement, different positions, different breathing techniques. I think it's really good to prepare for that. So be patient. Let labor start on its own if you can. I say that, but I'm very impatient. Let labor start on its own. Rest in the beginning. Have your birth plan written out. Have your support system prepared with you and knowledgeable about your birth plan. Have your safe word. And also prepare yourself and your support people to help you follow through. So good luck with that. What all should be included in a birth plan? Oh, that's a good question. So your birth plan can include all the information you want to give the doctors and nurses that are taking care of you. So first of all, you want to talk about any medical history that you have, any allergies. You want to talk about labor, whether or not you plan to get pain medication, an epidural, what you plan to use for your comfort, what positions you want to use. So some people want to actually walk around, which is an option. You can get out of bed. You don't have to labor in a bed. You can walk around. Most places should have monitors that allow you to leave the room or leave the bed if you need to be monitored. That can also be included in your birth plan, how much monitoring. If you're low risk, healthy mom, healthy baby, pregnancy's been completely normal, you don't have any medication on board, you're not being induced, you don't have to stay on the monitor the whole time. You can request intermittent monitoring, which means they kind of just check in on baby, make sure everything's going great here and there, to make sure baby's tolerating labor well. So monitoring positions, whether or not you want to eat light snacks. I mean, guys, when you're in labor, don't eat steak and potatoes. You just don't want to do that, because what you eat in labor can come up. And we know when you're pushing, what you eat is going to come out, right? So keep it to light snacks during labor. Some other things you want to include is who's your support team? Who's going to be in the room? Who are you okay with in the room? Is there anybody you don't want in the room? That's very important. Some people want to be there and we don't want them in the room, and sometimes we have to put that in our birth plan and let the nurses be the bad guys to say, hey, this person has on a red shirt. If I give you this signal, they need to get out of the room. And your nurse can say, all right, come up with an excuse to clear the room. Also, pushing positions you want to include. You want to include things that can come up that are unexpected. So if there's a reason your labor stalls or slows down, what methods are you okay with for them to augment? Meaning, what medication or procedure am I okay with accepting to push my labor further along? I'm trying to think. I'm thinking of this off the top of my head. You want to include baby's procedures. So when baby's born, who's going to cut the cord? Do you want to do skin to skin right away? Yes, you do. Breastfeeding. Are you okay with baby getting immunizations there? Starting immunizations in the hospital and things like that. I think I covered all the bases, the generic things that should be on a birth plan. But of course, Labor and Love can do your birth plan for you. We can talk about it. We can you can be educated on all the different procedures, medications, all the different steps that can take place during a labor, and decide what you want, what you don't want, and we can make a beautiful birth plan for you. So let me know if you're interested in that. Let's see, another question. Is there a genetic birth plan online to get an idea? Oh yeah, there are plenty birth plans online you can look up to get ideas of what people include, and ideas of what you want. The thing is, with a lot of birth plans that I find, people see this stuff and you don't know what they mean. So definitely look up some stuff online, and if you have any questions, feel free to reach out to me. I love having skin to skin with my second. Oh, skin, y'all, skin to skin. I am such a skin to skin fanatic and advocate. So after birth, skin to skin is great for mom and baby. So newborn babies cannot regulate their temperatures. Skin to skin helps to keep them warm, helps them stay calm. It helps them to regulate their breathing and their heart rate. And it is also your go-to, not just for in the hospital, but once you get home with that baby. Skin to skin helps promote breastfeeding, increase milk supply, all those goodies. So skin to skin is just great for right after delivery and even ongoing when you're at home. Now I can tell you guys, doing so much skin to skin, my baby still needs to touch my skin. She's getting a little bit better, but she still loves to touch my skin. When she's sleepy, I know that that's like her soothing method to either lay close on my skin or she pinches my neck. Oh, got it. Definitely. We need to get together. Yes to the skin to skin. Skin to skin, y'all. Can't get enough of it. All right, that was the last question. So if anybody else has a question, y'all can type it in. But in the meantime, I'm going to make some announcements. So if you're in the New Orleans area, Metairie, Slidell, any of the surrounding areas, on June 30th, Saturday morning, we will be at Lakeside Mall at the New Orleans Baby Expo. Come see us. We're going to be doing some fun things with comfort techniques for labor. We're going to be talking about labor, what to expect, different massage techniques, aromatherapy, and then we're going to talk about some newborn things. So swaddling, if you want to learn how to do that, come on by and see us. It'll just be fun to meet some people in person and to see some of my friends, guys. Come see. Another thing is coming up soon. I don't know if you guys have been to laborandlove.org, but the landing page is there. So if you visit laborandlove.org now, you can literally sign up for the mailing list, which is awesome. Please do so if you haven't already. But later on this summer, we will be launching the full site. So it's going to be the website with the blog/vlog that I'm really, really excited about. But in the meantime, until that website gets designed and up and running, because I'm not a technology person, guys. So please go now. Well, I need to learn how to get the link up to you guys, hopefully by tonight. But please go to YouTube. There's a Labor and Love YouTube channel now. I'm excited about that. So go subscribe, please. So right now, it's a few videos up. I think I can save this Labor and Love Live and post it to YouTube. I need to figure that out. But some really, really cool videos, and they're going to be more uploaded soon. So y'all go ahead and subscribe to that. Otherwise, it's been fun, y'all. Everybody have a good night. Go get back to those babies. Oh, wait, we have a question. My friend recently had a baby. She had a C-section, and now she's having pain where the cut is. Is that normal? And what can she do to soothe it? How long ago did she have a baby? So someone who recently had a baby is having pain at the incision. And her friend is asking, what can she do for this pain? And is this pain normal? So I'm just waiting to see how long ago did she deliver. So something to remember, a C-section, although it is a very effective method of delivery, safe, life-saving at times. The baby will be a month on the 20th. Life-saving at times. It is major surgery, so you can still have pain. Yeah, she can still be having pain. I would say as long as she's not, the incision doesn't look infected, meaning unusual amount of redness, any type of drainage, yucky stuff on the incision, and no bleeding, definitely. If she has any of that, she needs to call her doctor. If she should have some pain medicine that they prescribe. Mommies who have C-sections, my hats are off to you. You had major surgery, so don't be a martyr and feel like, oh, I'm not going to take my medicine. No, take your medicine. The baby will be a month on the 20th. So yeah, it's been about a month. C-section recovery is like 8 weeks. So anything going on between now and then, I would definitely call her doctor if she doesn't have pain medication, just to make sure everything is normal. So I do expect pain after surgery. Even moms have pain after vaginal deliveries. So with the C-section, yeah, let her call her doctor, and just especially if she has any of that other stuff going on. You're welcome. All right, y'all. Have a good night.